Today's Activism segment comes to you, as always, in partnership with the UnFuck It Up project, where creator Katie Goodman and activist director Katie Klabusik highlight individuals and organizations working to change the world. Today's campaign, Medicare You Can Buy Into. As covered before on this show, the Affordable Care Act is fundamentally health insurance reform, not health care reform. It does improve access to care for millions of Americans and reduces costs for individuals and families previously paying outrageous premiums. Hopefully, it'll also reduce the overall cost of health, a need that eats up around 17 cents of every dollar spent in this country, as people need not wait until they're in an emergency situation to see a doctor. But gaps in coverage remain, largely due to the majority of Republican governors across the country turning down the Medicaid expansion. What this means is that everyone should definitely take advantage of the plans afforded so many under the ACA. If you haven't yet, visit healthcare.gov before the December 15th deadline to have your coverage begin January 1st. After that, however, we still have work to do. Congressman Alan Grayson is urging Congress to expand Medicare so that anyone can buy into it. This is not freebie, government-paid-for health care as right-wing pundits and politicians spin it. Grayson's plan, being supported by a joint petition through the Daily Kos website, would simply allow you to purchase a plan through Medicare as you would a plan through any other company. The difference is how much more efficiently Medicare is run and how much simpler it would be to access. Your plan need not be tied to your employer with Medicare. It also need not be tied to the state where you live. It would also be cheaper, likely much cheaper. The average private insurance company now spends 20% of its funds on administrative costs, down from around 30% before the ACA. Most studies of Medicare find that the program spends between 1 and 3% of its funds because it has no profit incentive. Medicare is an already existing public option. The Affordable Care Act can be approved upon without bulky, wonky legislation that would require a massive public support push to pass. H.R. 500, the Medicare You Can Buy Into Act, would add a public option to increase the competition in the health insurance market that even conservatives claim to want. Visit dailykos.com/campaigns to find the petition and contactingthecongress.org to encourage your representatives to become co-sponsors of the Medicare You Can Buy Into Act.